Hello guys, today is February 23rd and this is the Japan coronavirus update. We have 26 new infections that are reported in Japan as of Saturday, so as of 18 hours ago. A really alarming development in this story is actually a school teacher testing positive. If we go to the article, a teacher at a public junior high school in Chiba Prefecture has tested positive for the virus. The mayor of Chiba City says that the school will stay closed until next Wednesday. I don't know how effective or what the point of that is really, but okay. And then over here, elsewhere in Japan, prefectures have reported cases to include Tokyo, Kanagawa, Aichi, Ishikawa, and Kumamoto. And in Hokkaido Prefecture, there has been a rise to 16 cases. Authorities say, including cases from the Diamond Princess cruise ship, the total number of infections now stands at over 750. Wow, that's a lot of people. So in Hokkaido, another woman is infected with the virus and she served school lunches. Wow. Officials in Ebetsu City, in Japan's northernmost prefecture of Hokkaido, say a woman found to be infected with the new coronavirus works at a local elementary school, and she is responsible for delivering school lunches to classrooms. Officials said she wasn't involved in cooking the meals, which is done at a different location. They said she was wearing a white robe, face mask, and gloves while at work. Not really effective because there is some scientific evidence saying that this stuff is not preventable with just a mask. She developed a fever of over 37 degrees Celsius, and that's when she stopped coming into work. So she probably infected a couple of people by going to work, as she was already symptomatic by February 14th because she had a sore throat. So in the government response to this is Abe orders measures for possible surge in cases. Possible surge? That's already happening, but okay. The situation has entered a crucial phase after cases with unknown infection routes were reported in multiple regions of the country. He said reliable and effective preventative measures must be implemented to curb the increase in patient numbers and contain the outbreak. It doesn't get into the specifics of what he meant by that, but who knows. Task force members at some medical institutions have begun administering the anti-flu drug Avigan to virus carriers to find a treatment. The Prime Minister instructed the members to step up monitoring of the health of people who have disembarked from the quarantine Diamond cruise ship. Seems pretty common sense to me. And then, here is another example of the government incompetency. 26 passengers were released without being tested. All the passengers and crew aboard the Diamond Princess were tested at the start of a 14-day period around February 5th. 634 passengers were confirmed to have the virus, and then 969 passengers tested negative, and were not showing symptoms, so they were allowed to leave the ship between Wednesday and Friday. Now, that's a little bit contradicting, and you can see how that gets controversial because we've seen a couple of people who are not showing symptoms do test negative and still end up getting positive down the road. And here is a good example of that because a woman in her 60s disembarked the Diamond Princess in Yokohama on Wednesday, but she was found to be positive following another test in Tochigi Prefecture. So I guess she returned back to Tochigi Prefecture where she lives. And the ministry is trying to reach them for testing. So this Diamond Princess cruise ship thing is really disorganized and it's just become a hot mess. And that just comes to expose how incompetent the Japanese government is with containing the virus. Right now, most official figures put the infections in Japan, aside from the Diamond cruise ship, to about 100 something, but I think it's far more than that. Obviously, because here, ministry officials were not tested after being on the ship. So ministry officials visited the ship and they didn't bother to test themselves after getting off. That is very laughable and ridiculous, but okay. A cold, hay fever, or COVID-19, Japan's health guidelines raise questions. Experts have raised questions about whether asking the public to observe their symptoms closely before seeking consultation will actually prevent a rush on clinics and allow those with serious conditions to be treated in a timely manner. Right here, the director of Tokyo-based Navitas Clinic believes that such requests to the public may not be effective in separating coronavirus patients with mild symptoms from those suffering from other conditions. Kasumi also said the move may not prevent the spread of the virus. Well, of course not, because even to this day, as I said in my last video, there are only certain people that are allowed to get tested for the coronavirus. So if you're just a random person and you call the consultation center and you're like, oh, I've been having these symptoms or whatever, if they don't think that, they don't suspect that you have the coronavirus, they're still not going to test you. So I think aside from the confirmed cases, there's probably a lot of people under the radar that actually do have the coronavirus and then unknowingly spreading it. So I think that there will be an outbreak if you don't want to call it an outbreak just yet. We've seen it in South Korea, but they seem to be handling this a little bit better with testing heavily on anyone that they think could have the coronavirus, no questions asked. And that's how you go about it. But Japan doesn't seem to see the urgency about that. And there's still no travel ban, so that's cool. Not really. So amid virus outbreaks, 6 toll gates closed in Japan, and this is in Nagoya Prefecture, where they are known to have some positive cases. And then the U.S. raises the travel alert to Japan to level 2 on the 4-level advisory scale, amid reports that a new coronavirus originating in China is spreading in Japanese communities via unknown infection routes. Yes, good for the U.S. Sustained community spread has been reported in Japan, which means that people in the country have been infected with the virus, though how or where they became infected is not known, and the spread is ongoing. So given what's going on and basically not knowing what's going on in Japan because of the incompetency and the disorganization of how the Japanese government is going about this, it would be a very good time to start preparing. As you've seen in South Korea, there has been a jump in cases. I hear they're doubling every day. And if you look into what's going on in Korea, they're already having shortages and people are panic buying. And so you want to be ahead of that before you get yourself caught up in all of that if you live in Japan. If you have plans to travel to Japan, I really don't think that that's a good idea. But, I mean, come at your own risk, I guess. That's all I have for today, and see you next time.